23 years ago, I had met Dr. Ree, and I was looking for an endodontist to take care of our patients in our restorative practice in Woodbury. And I'd worked with several endodontists years prior to that. And one of the biggest obstacles that I had bumped into is when patients were in pain and needed endodontic care, we would call to help schedule them in an endodontic office. And the typical response would be, we can see your patient in 2 to 3 weeks. And when you're in pain, that's an awful thing to have to tell somebody that they got to wait 2 to 3 weeks to get out of pain. And at that time, I had met Dr. Ree, and Dr. Ree had promised me 23 years ago, which is amazing, that he says, Mark, if you call our office before noon of that day, I will do everything I can to see your patient to get him out of pain that day. And he made me that promise 23 years ago, and I have to honestly say he's been able to follow through on that every time we've called. It's been amazing. And that's, to me, one of the most important parts of endodontic care or for an endodontic specialist is to help get people out of pain in a timely manner. And so one of the reasons why I refer to Dr. Ree is the fact he is an endodontic specialist. And the reason why I, as a general practitioner, do not do endodontics is because I've really learned it is a true specialty. You need very specific equipment to perform the job at a top level. And doing it every day, you become so proficient at it as a good endodontist like Dr. Ree that it really allows you to get more of a consistent A+ end result. So when with Dr. Ree, with the patients returning from his practice with really top A+ type endodontic results, I can with confidence ask people to restore the tooth with the crown or a bridge or larger restorations, knowing I can count on that tooth lasting many, many years.